Hi, good morning, everybody. This is Dr. Jenny Byrne. I'm talking to you today as part of a Facebook Live series on lessons that I have learned from my patients over the years. Last week I was out of the office and it gave me some time to think. And one topic which comes up, and not necessarily at the holidays only, but really any time, is the idea of illness and when to kind of fight and when to move into acceptance. And this is important because there's actually different types of psychotherapy out there that are based on acceptance models. And there are other types of psychotherapy that are based more on fighting or resisting or moving past it. So knowing when to fight and when to accept is really actually very difficult. So when we're in medical school and we're trained, most of what we're trained on is how to fight illness. Illness is the enemy. Health is what we're aiming for. We should always be healthy. We should never be sick. And if somebody is sick or has illness, then it is our job to fight that illness and help them get past it. We don't spend a lot of time on acceptance or things that we can't fix, things that are chronic illnesses that we don't really have treatments available for yet. So doctors aren't really very good at this in general, and I've been surprised over the years to learn that even doctors who specialize in cancer oncology, where you'd think there's a lot of terminal illness and they have to deal with acceptance, they're often not that good at it either. So it's a skill that's actually very difficult and that we don't get a lot of training on. So how do you know when to fight and when to accept? Obviously I don't have a right or wrong answer. Every situation is a little different. But I can tell you what I've learned from my patients over the years is that there are times when you need to fight. So if you are suffering from mental illness problem that is treatable, and you are not functioning well. So for example, if you have major depressive disorder and it is to the point where you're not functioning well, you're not able to take care of your family, you're not really working very well, you're going to lose your job, you're not getting out of bed in the morning, you're just really not yourself at all, it makes all the sense in the world to try to treat that, because there are a lot of different treatment options out there. There are medication treatment options, there are psychotherapy options, there are options like transcranial magnetic stimulation or ECT or ketamine or all sorts of things kind of available to you. So if you have major depressive disorder and you're not functioning well, I think it makes all the sense in the world to treat it and to fight it. And what's interesting about this is that even though doctors are trained to fight disease, fight illness, sometimes we don't get people all the way into remission. So what does that mean? Remission is, you might have heard of this if you've known somebody that had a cancer diagnosis, right? Let's say if somebody had cancer, you would want a treatment that they would respond to, meaning that when they had the treatment, the cancer responded to it and started to go away or to shrink, or at least to stop growing. But what you would really like is for someone to go into remission, and that means where their symptoms are either gone entirely or the symptoms are so tiny and unimportant that we consider them almost gone. So the same kinds of ideas can hold true for depression. You can get a treatment and respond to it, meaning you start to feel better, but you still don't really feel all the way better. You don't feel yourself. And a lot of people I see get stuck at this place where they've responded to a treatment, but they haven't gotten all the way to remission. And it's ironic that sometimes doctors aren't very good at pushing people into remission for depression. I think the reason is that we don't have like a blood test the way we do for something else. So let's say you were treating cancer, you maybe have a blood test to see how your cancer is responding, and you have a number that you can put onto it and get people into remission. So in depression, we typically just ask, how are you doing? And we ask about your symptoms. And we don't really get that quantitative number to push us to get you back to normal. So one thing to think about when you're fighting something like depression is that you really want to get to remission. You don't want to just get halfway better. And if you're working with a doctor and you feel like you're not all the way better, you need to tell them. And sometimes doing a rating scale like the PHQ-9 for depression can help because it puts a number on it. And sometimes that number can be helpful to kind of push the treatment into remission. So that's an example of when I think fighting makes a lot of sense. Now, when is it better maybe not to fight? So this is hard, and this is a question where you might say, well, why are you telling me not to accept? Does that mean to give up or give in? And I don't mean to give up or to give in. I mean to go into an acceptance mode of understanding your illness. Why? Because sometimes going into an acceptance mode of illness, you will actually feel better and function better in an acceptance model. So when would be an example of that? So one example that comes up for me quite often is patients who have dementia. They've been diagnosed with Alzheimer's dementia or some other kind of dementia, and they've been placed on medication to help reduce the decline of their cognition over time. So for dementia, we don't have a cure. We don't have medications that get rid of the dementia. We don't have treatments to put it into remission. So the medications we have only slow the progression over time. And these medications are fine, and in some cases they make a lot of sense. But sometimes I'll see a situation where there's an elderly patient with dementia, maybe not even that elderly, but someone with dementia, and they're in fighting mode. And so they want to take every medication under the sun that could possibly treat the dementia and make it not progress. And then they take a lot of medications and they get a lot of side effects. And the side effects make them have other problems. So the side effects make them really sedated, where they're not, they're kind of tired all day, they're not really getting much out of their days, or maybe it makes their balance worse, and then they're at risk of falling. And falling can lead to hip fractures, which can lead to surgery, which can lead to hospitalizations, which can lead to a lot of things which make dementia worse. So the point I'm trying to get at here is sometimes if we don't have a great treatment, you have to be a little careful with the fighting, because if you fight and fight and fight, sometimes you create new problems. And the new problems sometimes are as bad or worse than the original problem. So going into an acceptance mode, again, I don't mean stop taking medication necessarily, but getting into the mindset of, if there's no treatment that's going to help, to how am I going to live my life, or how is my loved one going to live their life in the most meaningful way, in the most healthy way, meaning, good energy, good sleep, good appetite, good mood, able to do things they enjoy. What is going to lead them to that? And sometimes the answer is not fighting and fighting and fighting and fighting. So again, I know this may sound strange to some people used to thinking about just fighting illness or the doctor's role as to just combat illness, but I think our role is really to promote health. And when I say health, you can have health and still have an illness, right? So there are a lot of people living with chronic illnesses who can have great health and can have a great quality of life. And there's some people who are very mentally healthy, even though their body is not. So I've worked with a lot of patients over the years who have taught me that sometimes you fight the depression, but you accept the physical illness. So sometimes you're actually fighting and accepting at the same time. And again, this is if there's a medical illness where there's no good treatment available, or you're taking medicines or things that are causing new side effects or problems, sometimes it's better to focus on the depression and fighting the depression to get mentally healthy, even though your body may be physically sick. And this sounds really weird. And if you've ever worked in a hospital, you observe this phenomenon, you would think, right, that if you go to a hospital and everyone is really, really sick to the point where they need to be in the hospital, that every person is going to be depressed, right? Because you think, well, their body is sick, so they're mentally going to be sick as well. And while there is a lot of depression in the hospital, it's actually less than you would think. So this is a fascinating thing that I saw in the hospital. There are a lot of people whose bodies are very physically ill, who are very mentally healthy, and they're not depressed. And they're leading as good of a life as they can with their current body. And mentally, they're actually doing well. So sometimes there's this weird disconnect where you can be mentally healthy even though your body is ill. And sometimes you fight to stay mentally healthy, fight depression, even though what's happening to your body may not be something that you can fight. So I'm not sure if that sounds strange or if that makes sense to you, but these are things I've observed over the years. And there's no right or wrong answer, but coming out of school, I assumed that you were always fighting. And my patients have taught me that sometimes you don't fight. Sometimes you go into acceptance, and that's how you get mentally well. And sometimes you fight one thing, even though another thing you can't fight. So this is something I've learned over the years. I'd love to get your feedback and see if you've had any experiences with this. I hope that you're handling the holiday season as well as you can. Again, I talked last week, this is a hard time of year for a lot of people. So if you feel like you need help, please reach out. We're here and we're open most of the holiday season to help. So take care, and I'll look forward to talking with you again next week. Bye-bye.